This is night, day in the life of an African nursing student who's in level 2 of her 4 semester nursing program. Forever grateful that I've been doing well so far. But just a quick what I've done, because I ain't gonna record, because I just decided, you know what, I'm gonna just do like a day in the life of an African nursing student. Like, why not? Why not? Yeah, so just a quick rundown of how my day was today. So I didn't actually wake up that early. I woke up at like 7 a.m. I had like this really bad stomach pain. So I made ginger, lemon, and honey tea. I put a little bit of moringa powder. My mom swears for moringa. So I used that. And I drank that tea and I went back to sleep for another like couple hours. I was supposed to go hang out with a friend, but I told a girl I can't. My body's telling me I gotta rest. Yo, welcome to almost turning 30, bro. Couple more months, I'll be 30. I'm not gonna lie, initially I was like low key scared, low key like, oh my gosh, there's so much stuff I haven't achieved in my life. Which, as you guys watch my vlogs, I'm probably just gonna post 2 vlogs a week or one. I have no idea. I'm gonna see what I do. Yeah, so that's gonna be my story. Oh, yeah, other than that, what else I do today? Of course, I had my breakfast. I actually did do my workout. I'm gonna just put a short clip of what I did whilst I was watching Becoming documentary by Michelle Obama. Hands down, the best, the best. Loved it. I'm now intentionally at this stage of my life. I want to listen to more like positive induced messages, positive induced music, um, reading more positive induced like books, things that are intellectually stimulating, because that's actually something I love so much. That's why I geek out when it comes to like I go through practice questions whilst I'm like having my lunch. That's another video plugged over here. Yes, I do that. I love it. And these days I listen to like podcasts about like different healthcare stuff. Since quick thing, my goal is to be a doctor, so yeah, I mean, of course, I'm in nursing school right now, so I don't know if I will go to medical school or not. God willing, only God knows, only God knows. But if it happens, it happens. If it doesn't, it's okay. I feel like God has a better plan for me, so I am just allowing myself to go according to God's plan and having my full faith in Him that He is guiding me to what I want or what is better for me. So yeah, even though I'm turning 30 and there's certain things that haven't happened to me yet, I have no kids yet. I mean, I'm married, thank God. Just no kids. But it's okay. It's okay. Yeah. One thing at a time, right? Yeah, what else I did today? I guess I did my workout, showered. Now I'm going through my rationales. I like reading the rationales, even if I get like a bad grade, which I'm going to show real quick. Yeah, like this is the grade I got. But honestly, these are like, random assignments we have to do in nursing school. So I don't really worry too much of getting, because the minimum passing rate is 75%. I don't really care too much of getting 75%. If I do, that's great. If I don't, it's not a big deal to me, as long as I'm doing good in the exams, which I've done so far, again, by the grace of God. So what I do as part of my studying ritual, I read the rationales, because these are like gold mine knowledge. And then, of course, like I showed earlier, I'm a Google LM, which I listen to the podcast version of all my PowerPoints, since I want to tend to read. Like, who got time? Come on. We're trying to be smart here. Go through flashcards, the quiz. I will eventually also create another flashcard through Quizlet, which is amazing. I love it. And I do like Nexus Nursing.
Welcome to NCLEX Bootcamp, where we'll give you everything you need in order to pass. NCLEX Bootcamp
ads,
includes 50 next gen.
Hi guys, it's me. I love Nexus Nursing. Dr. D, she gets you right. Like, she literally helped me with my OB exams. I like her videos because it pretty much gives you the strategy of how you should think when you go through all these NCLEX style questions, even the next gen type questions. There's another resource my school has. It's called HESI Case Studies. I don't know where to find it right now. But if your school has the software Evolve, I'm sure you have it. If not, I don't think it really matters too much. But maybe even just Google next gen questions on YouTube and just watch a nursing educator like read the questions, break down like why this is the answer, why the other choices were not the answers. It really is helpful. Um, However, I do like this other lady. Her name is Your PRM Receptor on TikTok. She really highlights the importance of it's okay to like do great academically, but you also need to know how to apply your knowledge clinically in a clinical setting. Because the real test is when you become a nurse. Yeah, you're going to be trained, on the job, what to do and stuff, but you are being taught the fundamentals. And once you pass your NCLEX, of course, you're a qualified nurse. But to be that nurse, like the nurse, you gotta like know your knowledge and how to implement. You want to know how to recognize certain disease processes or whatever body failure is going on with a patient, and you also have to anticipate what kind of medication. That's where pharmacology basics come in. What kind of medication the doctor or medical provider is actually going to order for this patient, and also how you can correct the medical provider. Like, hey, you prescribed this medication, but this patient has this disease process which is contraindicated to this medication. I think you should reconsider. Like, that's how you should be thinking as a nurse. And I know in my pharmacology class, my professor does these patient education activities where, like, I mean, I wish I could, like, show it. That'll be another vlog because I do love them. So literally, like, we go through, it's pretty much like a case study. So certain patient has these certain vitals, has been admitted to the ER for this kind of whatever illness. The doctor ordered this medication, and he literally asked, why do you think he prescribed this medication? What's the contraindication? What's the side effects? What's the adverse effects? What's the antidote in case this medication will lead to a toxicity? What is the name of the antidote for that? What would be, and for the specific order, what could be a better medication administered for this patient? Like, some patients can't take a certain diuretic because they may have a sulfur allergy, something like that. Or some diuretics you should administer because they're already hypokalemic, meaning they have a low potassium level. So the better diuretic will be a spironolactone or potassium sparing. And I like what Dr. D says or calls them, potassium saving diuretics. Diuretics are like medication that make you pee a lot. It's another way to like release excess water in your body. Yeah. So I don't know. I like the push education. Like, again, I geek out with this stuff. That's how I am. I love it. And I was listening to Michelle Obama talking about how like you should just embrace who you are. And like I felt like I was dumbing myself down my first semester of nursing school, but it's who I am. I am a proud geek. I love beauty products. I love, big hair. I mean, yes, I have braids on, but I love show off my afro. There'll be a vlog where I will do that. I like to look good. I like to feel good. I believe in God heavily, and I'm proud of it. I'm proudly African too. Like, yeah, I mean, it does feel weird being like one of the few black people and very few Africans. I think it's only like 3 of us. Yeah, but they're not even in the nursing program. They're like in the computer science or whatever. And then like maybe a few like Jamaicans, very few. Yeah, it does feel awkward coming from like Penn State where like you see people from like different parts of the world, like literally different parts of the world. But now the school I'm at is not like that. So I'm like, dang, I came from Penn State. I meet someone from like Barbados or like Cape Verde. I met someone from Poland. I met someone from Kazakhstan. I met someone from Netherlands, Switzerland. Like, you meet everyone from different parts of the world. It's amazing. It was amazing. That's what I miss a lot about Penn State, hands down. I'm forever a Penn State girl. I still wear my Penn State hoodie when I go to my school. I know it's weird. I should be like representing my school, but I don't really care too much. I'm only there for like 2 years. Well, I have 1 more year left anyway. and then that's it. Yeah.